Food safety and allergen management is so important because we know that there is a high number of people who suffer from allergies and intolerances. It's really a key point within our operation to limit the risk, as these can cause harm in future.
Allergen management is important in hospitals because often patients aren't in their familiar surroundings. They might be worried that it's not a controlled surrounding like they'd be at home, and they're unlikely to then eat as well, which can hamper their recovery and lead to significant pressures on the clinical team. They're then focusing on the catering side and what can this patient eat, rather than actually that caregiving and the clinical management of the individual. There was a recent outbreak of listeria in hospitals, which led to the National Food Review for hospitals. And this then led to the National Healthcare Food and Drink Standards. This release then heightened the awareness and complicity around catering in hospitals. The current law states that we must provide information on the 14 major allergens. However, anyone can have an allergen outside of those 14. So it's important that we're aware of the ingredients that are going into our foods. The allergen laws have evolved recently. There's now Natasha's law that's come into effect, and it states that we must put the ingredients onto pre-packaged for direct sale items. People can be allergic to any type of protein. We often think of proteins coming from meat, fish, eggs and plant-based proteins. However, there's small amounts of proteins found in most foods. All allergens must be treated with equal importance, so there's two main types of reactions. The immediate onset, which could be something like anaphylaxis, or you have a more delayed onset, such as gastrointestinal problems or the development of a rash, but both types must be treated with equal importance.
It's really important that not only our trusts, but our FM providers have robust procedures in place to highlight allergen awareness.
In these days, as time has moved on, allergens, it's a daily thing. It's in everything. We see a lot of allergens, more increasing all the time.
It makes our job a lot more complex because on some wards you can have, say, 15 people with different allergies and you have to cook completely different meals, so you have a set menu, but that changes completely. And then we have to cook the meals, we have to seal them, package them, and then give them to the clinical staff to make sure it's the right patient's got the right allergen. When we're trying to design a menu now, we try and make it all allergen-free, and no gluten, no celery, no lactose. We try and make it all allergen-free to make it that little bit easier.
If you just change the mindset slightly and have that little look, there's a lot more out there. So you could use to substitute the ingredients by just breaking down the recipe, changing the flour, changing the dairy out of it, and then put the dish back together, and you can have a dish that stands out just the same as a normal one, but it ticks so many boxes and so many people could still eat the same.
Because we have a menu that's free from the 14 major allergens, and we also have a non-milk, non-egg and non-gluten ingredient containing menu, this allows us to actually have a bit more freedom when doing the standard menu. We focus on patient choice, preference, taste, likes and dislikes, and then a strong focus on nutrition to ensure that we can enhance that patient recovery.
When we design a menu for the retail space that we have, so the doctors, nurses and guests that come into us, we use a system called Drive. So we input the menu that we want and it puts back an allergen sheet, which we can then display on the counter daily. And obviously our staff will have the indication to speak to articulate the allergens out to people.
Sodexo have an allergen management policy which the site has to follow, and this is to ensure our patients and customers stay safe. To ensure that this is followed, we undertake regular weekly and monthly audits to ensure compliance with these standards. We have a big focus on the power of three, so that's engaging clinicians, dietitians and catering teams. And we do that by attending housekeepers meetings, and we have a nutrition steering committee which we attend monthly to ensure that patient outcomes are improved.
The power of three within a healthcare setting is really important. Having a consistent, clear message with all parties linking together will make food fit and safe for not only our patients, but anyone coming into our areas.
We are made aware of patients who have special dietary requirements through the dietitians. They're made aware of the patients by the ward teams. The dietitians then submit a special diet pro forma down to the kitchens via email.
The chef will prepare the food in a separate area.
I would label it, all the allergens, all the tolerances that are in the dish. I would also put their name, their personal details, maybe their bed number. I'll put it labelled on a separate shelf and let the team know what we have to offer them still.
Within the National Food Standards, training and development of staff was crucial. Keeping staff trained is only going to secure good working practices for all involved.
Our teams are trained on allergen management through Sodexo's great training programme, and this focuses on small training modules that make sure that our staff know all around the law and how to safely provide food for our patients. Our diet chefs are trained twice during the year on special diets to ensure their knowledge stays up to date.
But in between that, we have lots of little interventions. So I'll talk to the team about allergens and changes and things like that. So it's about having the conversations with your staff to keep the training up to date.
Within our national competition, we designed tasks around certain criteria. This year, we asked the teams to create one of these dishes around allergen-free. What teams had to do was adapt a proactive approach to removing allergens whilst keeping the nutrition and calories high.
So the deconstructed lasagna we made in Chef of the Year was 100% allergen-free, just to prove that we can make nice tasting food that everybody can eat. You can make your gluten-free pasta, you can make your non-dairy cheese sauce. You don't have to put all this stuff to make food nice. You can have all allergy food and it's going to be fantastic in taste, to be honest with you.
Everyone involved in food has a responsibility for keeping food safe. Sharing information with each other is only going to benefit not only the patient, but the overall working environment.